with environmental health for almost 15 years. We're a large division within the health department, and I've been working trying to get our environmental health data out to the web for much of that time. So I hope to show you some of that.
Hi, everyone. My name is Martha Alexander. I work in the health department also in the division of epidemiology. I'm a health educator, and I am a cheerleader for the data that's available on our website at nyc.gov/health/data. My demonstration is very interactive, so I do hope that, no matter which one of us is presenting, I hope that you'll share any questions or burning things you'd like to see, because that helps all of us understand what your data needs are.
And my name is Matthew Montesano, also with the Department of Health. I am on Grant's team. I'll take you through the Environment and Health Data Portal, where my focus is on user-centered design, user research, and the design of data visualizations and writing data stories. And for the past year, I've also been working on COVID-19 data, and lead the department's work visualizing its COVID-19 data. And that's what I will be showing you later on in the session.
All right. Sorry, my mute button seems to be rusty, but I wanted to then just transition over to Martha to take it away for our first session. And again, thank you so much to BetaNYC for making all this possible.
Yes, welcome. Welcome to Open Data Week. I'm sharing my screen. There. Let's see if can you see the slides? Great, thank you. I was remembering as I was getting ready for this that I presented last year for Open Data Week, and it was the last presentation I did in person before COVID began. And I went up to, I think, to a layman college in the Bronx, and we were all awkwardly not shaking hands, but sort of elbowing and laughing. So here we are. So I am, we said, my name is Martha Alexander. I'm the Data Communications Outreach Analyst in the Division of Epidemiology at the Health Department. I believe that all of us in public health have an obligation to call out inequities in health and work towards health equity. And data is a tool for doing that. I'm going to give a brief introduction to data and equity, give a walkthrough of the main overall view of our website, the data on our website, and then show you how to use EpiQuery, which is one of our data tools. So the health department, as you know, because you've logged on, is a big city agency. We do a lot of work, and through some of that work, we collect health data. So we collect health data through giving out birth certificates and death certificates, disease registries, and health surveys. We use the data to track health conditions and conduct research. So we see through the data that in New York City, health outcomes are often tied to where people live. We know that a baby who's born in East Harlem has a shorter life expectancy than a baby born on the Upper East Side. Inequities like this stem from structural racism, which has led to inequitable policies and practices and resource allocations. And these have created unequal conditions across the city, including the disproportionate burden of COVID-19, which we'll look at that data in a little bit. So working to call out inequities in health is a big part of our work. I'm very inspired by the words of our former health commissioner, Mary Bassett, who said that inequities in health are unfair, unnecessary, and avoidable. And it's no surprise that these realities are reflected in our health in New York City. So we do make a deliberate effort to name and address these disparities in the work that we do. The graphic at the bottom here shows a little illustration of the difference between equity and equality. On the left side, everyone has been given the same sort of boost up to reach the apples, whereas on the right side, everyone has been given a box or the help to that they need to reach the apples. And so everyone, we define equity then as sort of equality of opportunity, giving everyone the opportunity that they need to reach their health outcomes. And being data people, of course, we do this with data. So these are some examples. I present mostly to community groups or groups of students. So I really just want to show them how they can use data to advance health equity. So it kind of falls into these buckets: to get to know your community, so understand local conditions. And with our data that's disaggregated, they can do that very well. You can use it to allocate funding, so to make decisions about where your energy should go, where your funding should go. You can use it to build support for issues and policy solutions. So you can use it to write, and to teach, to inform community members and guide students and researchers. Those are some examples, and I'm sure you could think of more. So now I'll walk you through these next slides are some screenshots and a little bit of information that gives a brief orientation before we look at the website. So we start at nyc.gov/health, which is the health department website, or nyc.gov/health/data, which goes right to the data tab. The screenshot at the bottom there, you can see the green hand is pointing to the data tab. So that's where the data is. That's where you can find the data. apart from the COVID data. It's in a separate place. So this is a screenshot then of the data tab. And I did want to say that we make the data available on our website because we know that other city agencies use it, community-based organizations, researchers, reporters, students. A lot of people access it to use it for things like research and grant writing, policy formation, programming direction, and evaluation. So whichever need you have for data, this is where it is. Our tagline is hundreds of stories, one place to start, because we want to make it easier to translate data into stories and to bring awareness to inequities across the city. So when you get on the data tab, so nyc.gov/health/data, you see three options: interact and visualize, data sets, and publications. I'll walk you through briefly just what's under each of those options. So data sets is public use data files. There's an option there called data catalog, and you can so you can search any available data sets. If you're doing analysis or someone on your team is doing analysis, they can access the data sets here. Publications is another tab. If you have an idea for a project or want to look up what's been written before, this is a great place to do it. You can search by topic or keyword. We have different series that emphasize sort of different points like health conditions or epidemiological strategies. And we have several special reports like about various diseases. There's the hepatitis report, tuberculosis, HIV, and there are some that are about different groups of people, like our Health of Latinos report or Health of Older Adults report. We're also working on one about the health of Asian and Pacific Islander New Yorkers. So these are great resources. And finally, the third option is interact and visualize. This is where we host our three larger data tools. So they're called EpiQuery, Community Health Profiles, and the Environment and Health Data Portal. EpiQuery is what I will walk you through today. You can use it to analyze and visualize New York City health data. The sources of the data are surveys, disease reports, and vital records. And you can disaggregate by many conditions and characteristics. This is an overview of the sources of data. So we have data from surveys, surveillance, and vital statistics. The 4 surveys that are covered are the Community Health Survey, the Health and Nutrition Examination Survey, Child Health Data, and Youth Risk Behavior Survey. So these are data from these are added each year or whenever they become available. And I'll show you how to search Community Health Survey data in EpiQuery. We also have disease surveillance. So for communicable diseases, STIs, vaccine preventable covers a certain category, HIV, AIDS, tuberculosis, and then the syndromic data, which has been very important throughout the COVID pandemic to track what's going on in emergency rooms. Finally, we have vital statistics data, which covers births, infant mortality, and mortality. And I did want to mention too, if you're very interested in vital statistics, we have a published report every year. That's a big PDF file that will have more information on that. In EpiQuery, you can download, share, or print the data. So you'll look for these little icons to download the data you're looking at. To share a deep link, so you could share like a link to the exact page you're looking at, and to print the visualization that you're looking at. And so just remember this website, nyc.gov/health/data. And the email address, if you have questions about what you find in EpiQuery, is query@health.nyc.gov. That comes to me, so you can email me. We get a lot of questions. All right, can you still see my screen? Cool, thank you. All right, this is the health department website. We still have messaging here about staying home. So I will click on data, and this is the main page. I showed you with the 3 options here: interact and visualize, data sets, and publications. To get to EpiQuery, we'll scroll down. It has this blue icon here. I'll click on EpiQuery. This is the EpiQuery homepage, and there are several ways to search the data that we want. We can search by topic. So under topic, we can expand each topic and find the subtopics. So for example, we could search under diseases and conditions, click on this, get things like chronic diseases, which includes diabetes or HIV, AIDS here, hepatitis. Those are topics. That's a topic menu. We can search by source. So we can look at particular surveys or the disease reporting, surveillance data, or vital statistics. Finally, we can search by indicators. If we click here, we get a long list of all the indicators. And another way to search by indicators, if I can scroll back up, is to type it into the search bar at the top. So you don't have to know too much about the data that you want. Like if you're not quite sure where to start, the search bar might be a good place. On the right, we have a data highlight to highlight some of the data, sort of pull out a story of what's going on with our data. And then at the bottom, we have a suggested citation if you are pulling data and using it. And and then the email address as well, query@health.nyc.gov. So that's an overview of the homepage. The blue bar at the top will include, there's a link to About, a link to Notes, which covers background information for all of the data you're looking at. Even things like if we're looking at the survey, community health survey, and you want sort of clarification on what was the question, what's the background information, you can find that here in the blue bar. And pay attention to the brown links here, EpiQuery Home. You can always come back to the EpiQuery homepage. So let's look at a link. Let's look at diabetes. I'll show you how to find information on diabetes. I'm looking under chronic diseases, and we get a big list, right? A big list of indicators. This is data from the Community Health Survey. At the top of the page, there's a drop-down menu, three drop-down bars here. So even when you're in EpiQuery, you can change the source. You can change the source of data you're looking at, and it will tell you who's the population. So is it children? Is it adults? Is it everyone? You can change to a different topic. You could change the subtopic. So that's one way to sort of change what you're looking at. Scrolling down the page, we'll see sort of a definition of the category of stuff we're looking at. And then we have this heat map here. So Community Health Survey, prevalence, the 6 most recent years are shown. So we have data from Community Health Survey in EpiQuery from 2017 back to 2012. And these would be responses on the Community Health Survey. So here's a huge list of conditions, right? I did say, let's look at diabetes. So just scrolling down a bit here, we can see that the diabetes question is asked every year. Sometimes you don't, sometimes things change on the Community Health Survey. So some questions are not asked every year. Sometimes they're adjusted a little bit. And that's where you will see the box for just 1 or 2 years. So I'm going to click on a data point to get into the diabetes data. So I'll click on this 2017 diabetes, yes. And just to show you the overall structure, the page looks the same. What you want to pay attention to in looking through EpiQuery pages are this blue set of blue boxes here, which is sort of the navigation of how to get through EpiQuery. It starts off with the sort of least complex things, so the indicator list, right, that big list of diseases, and then goes to an overview. Then there are a few options for analysis by neighborhood or by demographics. We can compare 2 indicators and then test the statistical significance. So in terms of web design, it goes from like the simplest to the most complex, which is just how I like to keep it in mind. Sometimes all you need is like the overview, the information that's in the overview. Sometimes you need to do more analysis. So for right now, I will show you what's in the overview. We'll have the question. What was the question on the survey? We have the overall prevalence for diabetes ever. That defaults to 2017, which is the year I clicked on. In this gray box at the top, we could change to a different indicator from the survey. We could change the year of this indicator. It's available a lot of years. We can look at the age-adjusted estimate or the crude estimate, so we could change that as well. So yes is on top here. That means that all of the data below will default to yes. So first we have a trend line. This is citywide data, so prevalence of people who had ever been told they had diabetes. And you can see the trend line over time. Scrolling down a bit, we have demographics. And again, this is the yes, right? So people who have been told they have diabetes. So divided by sex, by race and ethnicity, by age group, and by borough. And what I'll tell students when they're looking at this is like, look at where you start to see differences, right? Where do you see something interesting? The sex differential here is not so interesting. And then, but like maybe by borough or by race and ethnicity, you see more difference. And that's where you might want to start looking for your project or your research. At the bottom, we'll have notes. A lot of times the group is too small. So like this 18 to 24-year-old age group, we have a little asterisk here to say that the estimate should be interpreted with caution. But be sure to check out the notes at the bottom. And then we see our icons for downloading, sharing, or printing. And you can share like the exact link to what we're looking at. So that can be very helpful for talking with colleagues. I'll just show one more feature, which is the analyze by neighborhood. And for example, here, the difference here is that we can look at the map of the city and see the prevalence for each UHF, each United Hospital Fund neighborhood. So if you hover, you'll get the prevalence for that neighborhood. Down at the bottom, we'll have a trend line citywide. And if you click on any certain neighborhood, you can get the trend for that neighborhood as well. I don't want to take up too much time, but just to encourage you to play around with this. If there are any specific questions, if we have some time at the end, I'd love to entertain whatever, what is it that you'd like to see. I find that We get a lot of questions from community groups about how to find specific data, and this, I hope that it is helpful to you. Back to you, Grant.
Thank you. That was great. I appreciate it. I'm just going to share my screen. All right. Well, I'm going to talk to you a little bit about the Environment and Health Data Portal, which is our project within environmental health, and it's one of the things you can connect to from the Data tab on the DOHMH site, of course. So what is that? I guess I can introduce it to start with by where we came from. So in 2002, Congress began funding CDC to develop a tracking program and network. Now, when we're talking about tracking, in this context, we're talking about environmental health surveillance. So we're talking about tracking data over time to understand where the problems are, right? So the idea with CDC here was to bring environmental health surveillance into the same realm as disease surveillance, which is routinely done already for things like the flu and so on. So CDC began working with state and local health departments, federal partners, professional partners, and so on, as well as community groups to lay the foundation for a nationwide system to track environmental hazards and the health problems that they cause. And so we're with our site, we're trying to actually make a lot of that data available in a consistent format so that you can study and make policy based on data. So what kind of data do we have on the site? Well, we source data from surveys, operational data like restaurant inspections and so on, registry and other kinds of surveillance data as well. And we do that from all levels of government. So here's a small selection. You can see we pull NYC data directly from the health department, the research that we do, and that includes community health survey, which is a phone survey that our division of Epi does. But the environmental questions there we pull in. But we also do air quality monitoring with this an engagement with Queens College, and that is also available. But we also get data from other agencies like the fire department, and we pull stuff in from Open Data. One of the things we've been working on is trying to think more broadly in terms of environmental causes and relationships with disease, and so we've got eviction data in the site as well. We also get state data and federal data from a variety of sources. So we're trying to bring it all together so that you see a bigger picture of what environmental health looks like in the city. So here's just a sampling of our content, topics from, water quality to environmental sustainability, as well as things like asthma, cancer, bed bugs and cockroaches, always popular to look at in terms of pests and pesticides. So there's a lot of stuff on there. Actually, I think there's over 200 indicators and a variety of different measures within those. So just to give you an idea of what our day-to-day workflow looks like, we work with data stewards and take and intake public data sets. And we try to work closely with these teams that actually build the data so that we can make it easier for them to get the data into our site and make it so that the data is consistent and it follows certain standards of aggregation so that it's easier to compare the data over space and time. We also make sure that we have a pretty high standard in terms of metadata and messaging so that folks know what the data means. And that's something we'll talk about even more later. But once we've got the indicators created and the data ready, we upload them through our internal system and review the charts, make sure everything looks right in our QA/QC process. And then we take that data and we try to write data stories, which is something we've been doing a lot more of in the last couple of years. And also, just try to get the messaging out there whenever we can by engaging stakeholders outside. So that's a simplified workflow. So I think, it's important to understand that well-built indicators provide a consistent way of looking at public health data over time and space, but they also enable effective interventions where they're needed. And I think that's ultimately our goal with this website, is to help realize the mission of our agency to protect and promote the health of New Yorkers. I think environmental health surveillance definitely can make a difference in the right hands, and that we're trying to get it into those hands so that it helps influence, politics and government in the right way. So I have some examples here of how environmental health surveillance data can make a big difference and has made a big difference in people's lives. But I want to make the point that we can't, as an agency, intervene in all these cases. And so a lot of what we're trying to do is make sure that the data is there so that others can create legislation to make things happen. So I'm going to move into our demo now. I'm just going to pull up the website, but I'll come back to this page a little bit later. We would love to have your participation and your questions. So as I go through the demo, please let me know if there are things that you see that you'd like to see changed, or anything that you think is maybe missing from our site that you can suggest. It would also be wonderful for us if you'd like to get involved on a more regular basis. We have a user group. We've built this site for you and the other folks who are interested in data for policy, but we'd like to continue to improve it with you, and to do that really in sort of a co-design kind of in those kinds of terms, right? We have been working a lot with our user group over the course of the last year and a half, and we'd like to continue that work, and we'd like you to get involved. So please email us if you can, or just ask to be added to the list, and we'll get you on some emails. So let me switch to the site itself. So this is the Environment and Health Data Portal. You can get there from the Data tab, but you can also get there just by Googling NYC Environment Health, because that, for whatever reason, I guess it's a rare enough search term that we come right to the top there. So the main areas of our site are the Data Explorer, the neighborhood reports, and our data stories. So our data stories are one of my favorite parts of the site, and we have a lot of the headlines here. So we have new data stories on violence in the city, on housing and the history of redlining and health. And we have a redlining specific data story to provide some background. I can show you an example of the health, housing, and history data story. Matthew has been core in organizing and writing these stories in collaboration with a variety of stakeholders within the department. But it's a good way to try to provide a more accessible entry into what goes into thinking about environmental health issues in the city. We talk about a lot of different issues that are really relevant for a variety of health outcomes. And I think we do it in an engaging way. So I'm hoping that we can get your feedback on it as well. So other than data stories, we've got two core pieces of the experience here. The other one is these neighborhood reports. This allows you to get into our site from a locational perspective, depending on where you live. So if I wanted to look at the relationship between asthma and the environment, I can choose my report up here and then put in my address. That'll bring up a specific report. So this report is unique for the neighborhood, and what it does is it tells you, in comparison with other neighborhoods, how your neighborhood stacks up health-wise, and for a variety of indicators. So this report is focused on asthma. So we talk about child asthma, adult asthma, as well as a variety of risk factors that play into that, including home maintenance in rental buildings and outdoor air as well. So we bring a lot of data together here. So this is actually kind of jam-packed full of information, and it's easy to print and share. So it's a good thing to bring to your community board meeting, for instance. That's kind of the idea, at least. So we we also are in the middle of developing a brand new version of this, which should be released this year, that will be more mobile friendly. So you'll be able to just pull this report up on your phone and be able to share it that way. Now, I've saved the kind of the core of the site for last here. So this Data Explorer is how you can access all the data in the portal and browse it. So we have a variety of different topics: outdoor air and weather, the built environment, pests. You can also just look through an A to Z list or use our search to find data if you have a keyword that you'd like to look up. I'm going to just introduce you to the interface by looking at some asthma data. A lot of folks are interested in that. So if we look at asthma hospitalization data, this is actually state hospitalization data that we pull in and parse for different health outcomes. And so we can look at hospitalizations for asthma in children ages 5 to 17. So we start with just a data table, and you can see the latest year of data that we have uploaded is in here. We're actually, we're a little bit behind on updates because of COVID, but we'll be getting some more of this in here. You can select other years, though, if you'd like to add in back to 2005. You can see we have all of that data. You can also see the data over time by looking at the chart over time display. So you can see that, the Bronx is at the top here when it comes to asthma hospitalizations in this age group, but it has gone up and down somewhat over time. We also have a view of disparities by neighborhood poverty. So we've grouped neighborhoods into low, medium, and high poverty areas, or groups rather, and you can see that, as you might expect, it does go down a little bit over time, but in higher poverty neighborhoods, asthma hospitalizations are much higher. I should also, while I'm here, just talk about some of the other metadata that we provide. This shows you kind of how this is calculated, what defines a hospitalization, or what includes what makes that hospitalization included in this particular data set, and that's all in here. We also have a little guidance for interpreting the chart, and we provide more information down here as well as a link to a metadata site for more data source information.
Hey, Grant, excuse me, we got a question in the chat about if this data was by UHF or community district. I don't know if you want to address that.
Sure. Yeah, I'd love to. So one of the things about our site is that we provide data in a variety of different geographies. This particular one is available citywide, borough, and UHF. But we've been increasingly adding data by NTA. So why don't I just open up this in a new tab, and I can show you that some of our NTA level data. I'm not sure if it's available for asthma.
Yeah, there's asthma data by NTA.
There is. Okay, great. Thanks, Matthew. Yeah, that's right. It was on the previous screen. So yeah, we can actually look at the exact same data set, or no, this is the hospital or the ED visits instead of the hospitalizations, but you'll see a lot of the same stuff. So here's our NTA level data, right? So you can actually see this on a map, which I hadn't shown you yet. We're trying to get more information out there at that level. Often it means we have to bring data together, right? So here for this indicator, we're combining years so that we have the more statistical power for these things, and we are not having to worry so much about privacy issues for small cell sizes and so on. So yeah, you can see the data is available at a pretty high resolution here. Also, I can just, we have print, export, and link options for you if you are interested in doing any of those things. And there's when you do link, you're actually linking directly to this view of the data. So you can see in the URL, in fact, that you're actually linking to the map and this particular year and data set. So I think that's interesting for folks who want to share. They know they can share the specific data views. All right, so that's it. Thanks for the question. I appreciate it. But that's kind of what our Data Explorer looks like. The one thing I was going to show you that I hadn't quite gotten to yet was this link data option, which shows you a scatter plot. This gives you an ecological view of two different indicators that are mapped together. So here it shows this relationship between sulfur dioxide, which is a air pollutant, and asthma hospitalizations in a variety of different neighborhoods. And you can actually highlight the different neighborhoods to see what the variation looks like. You can see there's these Bronx neighborhoods where the asthma is pretty high, as well as the sulfur dioxide, whereas in southern Staten Island, both things are low. So it's interesting to be able to see that relationship sometimes. All right, well, I don't want to take too much time because I know Matthew's info is super interesting, especially right now. But I'd also just wanted to mention that we have these new key topic area hubs, specifically talking about climate and health and air quality. So those are other ways to sort of explore our content. And I encourage you to get in there and take a look at that. I'm bringing this slide back just to remind you, please reach out to us. We would love to get you involved in co-designing this site and continuing to develop it. Should be an active year for us, so it's a good time to get started. Thanks, Matthew. I'd be happy to hand it over.
All right. Thanks so much, Grant. I will steal your screen and share my own. So hello, everybody. I'm going to offer a quick look into our department's data on COVID-19. Our COVID-19 data, oops, I'm erroneously zooming here. Our COVID-19 data are a type of health data called surveillance data that's come up in both Grant and Martha's talk. And surveillance is obviously a very loaded word. What we mean by health surveillance data is getting data reported to us from the healthcare system. So the way that we get data on COVID-19 is, so if you're feeling sick, you go get a test. That test generates an electronic laboratory report that's sent to the State Department of Health and then eventually to us. Usually when the department reports surveillance data, what it does is it collects data for a while, and then it analyzes it, and then it reports it. And this process of analysis and cleaning the data and making decisions about sort of how to most properly make sense of the data and communicate it, that takes a while. With COVID data, we are doing all of those steps all at the same time, and we're updating our data every day because in a fast-moving pandemic, well, the data has changed every day, and sometimes these really affect people's lives and what's going on in the city. So the COVID-19 data are a little bit unique. As such, they have a unique place on the website right now. I'll give a quick scan through the website and talk about a few different ways you can interact with the data. When you land on the COVID-19 data page, which you get to from the home page, and you click COVID, and then you click data, it takes you to this page called Latest Data. And this is a view about what's happening right now with COVID in the city. This summary table takes a look at data over the last 7 days of data and compares it to the weekly average over the last 4 weeks. And we give a rough sense of whether or not these values for these sort of key indicators here are going up or are they going down. I'm a little bit distracted because my dog is scratching at the door. Pardon me. What we've done with this page is we've also interspersed a little bit of explanation about some of the metrics like confirmed and probable cases and confirmed and probable deaths in hopes that we're putting kind of the right information to help interpret this right there when you need it. We also have maps, and we've got these tables behind the maps that let you quickly search for your neighborhood, include a bunch of different metrics there. As you scroll through this latest data, you'll see a variety of different things, right? So this is data over the last 7 days. Over here, we look at hospitalization and death rates over the last 28 days. As Grant pointed out, sometimes data need to be aggregated either over a larger area or over a larger time period in order to have reliability and stability. That's why hospitalization and death rates are over 28 days. And further down the page, we look at what we call epi curves, epidemic curves of daily case counts for both confirmed and probable cases, hospitalizations and deaths, as well as these data by individual borough, deaths, hospitalizations, and cases. It don't always sound like this when I'm flying through these data, but having worked with these data over the past year, and on the sort of anniversary of the COVID-19 pandemic or the lockdown in the city, I don't think any of us ever forget that these numbers are all people. That's my emotional aside. One of the interesting things I think in this chart here is that we've got this pretty significant rise in cases that happened after Christmas and New Year's, and then things fell here as there's a sort of general. And I was trying to remember why. And I looked down here to see that testing also fell, and I'm pretty sure that's when we had foul weather And in foul weather, a lot fewer people are going out to get tested. But one of the metrics that we look at a lot is percent positivity, the percent of people tested who test positive. And we see that percent positivity has remained consistent for that same area. So what's really happening with this dip isn't that there are fewer people with COVID in the city, it's that there are fewer people getting tested. The same percentage of people are testing positive, but it's overall just a smaller number of people being diagnosed. So this is our view of the most recent data. And on these pages too, we also have views of, gotta pull the controls away in order to change tabs. We also have views of the long-term trends, right? So all of the data since we've been looking at and collecting these data. So we've got these same epi curves for the entire pandemic, the past year. These are hospitalization and death rates by zip code. We've got, again, data on testing available, 2 different types of tests, molecular tests and antigen tests. Antigen tests are the quickie tests. And, data on turnaround time, antibody testing. There's a lot of stuff in here. And if you click into totals, we also have cumulative data with breakdowns by borough, by group, age, sex, race, ethnicity, and so on. There's a lot in here, and we've tried to make it as easy to access and understand and use as possible. But there's also another view that we've added is this data by zip code for neighborhood data profiles. I live in Flatbush, so I always type in Flatbush. When you type in your neighborhood, you get this overview that offers data in a few different forms. I always find it really sobering to put, cases or a case rate, right? 6,000 cases, 6,300 cases per 100,000 residents of this neighborhood. To translate that into, 1 out of every 15 people in the neighborhood being diagnosed. For me, it has a different weight to it. And similar to the other data that we saw, these show values over the last 7 days, and then trends for different metrics over the last several months. So here we can really see what the wave 2 has looked like in my neighborhood compared to the borough and citywide as a whole. All of these data, we've tried to communicate these as clearly as we can. But all of these data, we make the underlying data available in a GitHub repository. So you can go here and you can download the CSVs files, comma separated value files, that feed these charts. And if you have questions, you can also find answers to some of these questions in the README, where we sort of document some of the changes that we've made to maybe our analytical processes, or some of the changes we've made to the files. We add a lot of notes about a whole host of different things in here, and also provide kind of in the individual folders where the data files are, we provide specific definitions of all of the metric variable names in those files. Since these are on GitHub, you can go there. You can download them every day if you'd like. You can even leave a question in this issues section if you're confused about something or need help with a definition, and we can answer those. We keep tabs on those as well as we can. We answer questions where we can, and we want to support people in using these data and understanding these data. I'll also note I am less involved with these two, but there are also these 2 other pages, Milestones, which shows a few of the key metrics that City Hall has been paying close attention to in order to monitor the pandemic, and data on vaccination, which shows the doses administered, both dose 1 and dose 2, and breaks down vaccination by zip code, by demographics, and a few other really important things. I really liked what Martha said earlier in the talk about it being so important to use data to tell stories of inequities. And I think that is really forefront on a lot of people's minds with how the pandemic's response, and the vaccination effort has played out in this city. We hope that we have made data available that can help people explore these stories, tell these stories, understand the pandemic, understand their neighborhood, and understand their own sense of risk in a very difficult time for us all, the city and the whole world. I think that's all I have on this. I suppose I can offer things back to Grant and open the floor up for questions generally, I believe.
I think that's right. I think we have a few questions already in the chat that we may not have answered, although Martha's been busy answering many of them as well. So thank you, Martha, for that.
Yeah, I think one question that is bigger than just typing a response is, are non-COVID data available in GitHub? And I think none of the data from EpiQuery are available in GitHub, but we can download them from the data catalog. If you go to the data tab, and under data sets, there's a lot to download, but not GitHub, as far as I know. And I don't know about the environment portal.
So with the Environment and Health Data Portal, we've actually been considering re-releasing a lot of our data and updating it on GitHub. And so if you think that would be useful, please let us know. I think that the Environment and Health Data Portal does have a data download feature. You can download all the data as CSV files directly from the visualization interfaces in the Explorer, but you can also go to the data download feature, which you have to scroll to the bottom of that front page to be able to create your own data set, or to download just a file with all of the data in it. So the data is definitely accessible, but via GitHub, not yet. Increasingly, our roadmap calls for us to be putting a lot of our code and resources out on GitHub, and increasingly on open data as well. So all of that is coming. But if it's a real priority for you, you should let us know so that we can figure out the best way to do it. One thing I didn't mention, actually, because I was thinking about open data, I wanted to just make sure that everybody knows that the health department does have an active open data program in place. And so what that means is we have infrastructure in place to bring a lot of our analytical and operational data sets into open data. And it's available. I mean, if you can go to the NYC Open Data site, you can actually filter by agency, which is something not a lot of people know. And you could see that we have data available for a variety of different things, including dog licensing, rat control, restaurant inspections. A lot of really popular data sets are out there. So please, we haven't specifically toured through that, but that is all available and super useful. I'm just going to scan the chat for more questions, but please, if you'd like to unmute yourself and ask, you're welcome to do it that way as well.
And Grant, I'm like selling my services, presenting EpiQuery, which I often do in the community. But
Good.
I know that you also have folks on your team who give presentations about the Environment and Health Data Portal regularly, right?
Absolutely, yeah. I give presentations regularly to community boards and public health classes, but I'd love to expand that. So if you are interested in a presentation, please feel free to reach out. I might be the one giving it. It could be Matthew, could be Nancy on our team as well. But of all of us, I'm probably the worst presenter. So I think you'll be in good shape no matter what. And we'd love to do it.
Denise, I usually present to like classes, or community group. If you have a group of folks who want to get together, that would be great. Sometimes to a specific community-based organization. Honestly, it's easier now that we're doing everything remotely. I don't have to travel across boroughs, coming home at 9 at night or whatever. I can be home for bedtime and still give a presentation. So it doesn't have to be that many people.
That's true, especially if it's a remote presentation. It's much less onerous for us than it was. So I'm seeing a question in the chat about how to get involved in doing data analytics and management on a full-time basis. I would love to see more people start working for the city. I know that hiring has come to a slowdown because of budgetary issues around COVID right now, but people are still hiring for the city, and I know that there are some openings that we're looking to hire for in the next several months. So keep your eyes on the hiring site. For sure, but one way to get involved would certainly be to talk to us about getting into our user group. We'd love to have your influence and input on how we organize our data, how we manage our data, what our priorities are, so that we can better serve the public. So, that's certainly a way to get started. I may not be the best person to ask, though, because I've been working in the same agency for 14 years, and the whole landscape has changed around data science, that's for sure.
Hello there. Can you guys hear me?
Yes.
Hi. I just had a question. I don't know how specific this question might be, but on the GitHub, with the GitHub pages, the GitHub page that has all the information about all the data coming in from COVID cases throughout the city, there's a distinction made between zip codes that I'm a bit confused about. Like certain zip codes are not what like the male zip code, like certain regions are considered as being part of a certain zip code, and
Mhm.
for just I'm trying to use the data
Mhm.
for a future project, so I was just interested to know how to parse it and how to make define that.
Sure. Yeah, I can answer that question. It's a little bit technical, but the answer is pretty simple. The data are basically by zip code, though technically what the resolution that they're actually at is called modified zip code tabulation area. And what that means is that there are some zip codes that are combined for the purposes of having a larger underlying population for health analysis. So the data files, the documentation says that the data are by mod zicta, but essentially that means zip codes, except some of the zip codes are pushed together.
So does that mean that certain regions are like on the map? If I were to see on the map, it would say that it's from zip code A, but it's taking data from zip code B, or is there any way to like I guess be able to define specifically where the boundaries are?
So one of the examples, which you can find if you like go to the website and you look at East Williamsburg, it is 11221 and 11249, but those are just considered one area. So that's an example of a modified zip code tabulation area that contains two different zip codes. Those are aggregated for the purposes of a stable and reliable health analysis. So what we can't do is offer them in a disaggregated way. Does that answer your question?
Sorry. Yes. Thanks.
You're welcome.
I don't know. I saw this a while ago and I was really confused, and I'm actually surprised that like I get to be on a Zoom call with the people in charge of it and ask the question directly. So it's very interesting. Thank you very much.
You're welcome.
Isn't Open Data Week awesome?
The best. I just found out about it yesterday. I wish I'd found out about it earlier. And this is honestly such a great. I wish I knew about it years ago.
I have a question. And just in doing this for so many years, I'm sure that there's like common misperceptions about like how data can like be the truth or answer questions, or sorry, how data like people probably come to you with questions that they expect you to answer. And I'm wondering, like, especially around COVID, I'm sure they're very common ones. And I'm wondering what some of those questions might be, if you have any stories of, the common misperceptions of the data available or the data that people want, but that doesn't exist, or the challenges of finding answers to certain questions. Like, what are some of the challenging questions that people come to you with?
That's a good question. I think I can start to answer that from a COVID perspective a little bit. One of the things that we've fielded and we've seen a lot over the past year is that the values that the city reports are different from the values that the state reports for the city. And it would be great if they were identical, but there are really different information pathways, analytical processes around things like deduplication and geocoding, and some different ways of reporting metrics, of calculating things like percent positivity, that mean that the city's values and the state's values for the city are never going to match up. And that's frustrating, right? Because if we're talking about like the number of people that something happened to in this area, you'd think that there would just be one number for it. And unfortunately, there's not. That took on specific importance in the fall when a lot of people were paying attention to percent positivity as a way to determine what parts of the city would close down in some capacity. The important part that even though the state and the city were reporting different values for percent positivity, they were moving in the same direction. So it's almost less that the specific number is important, that this specific data point carries a piece of truth, and more like the whole landscape, the movement of this value, what's affecting it and why. That whole comprehensive story is so much more important than the number. I think that's a pretty good example. What sort of defeats my point, though, is the fact that people were making decisions based on a specific value of a specific metric. So that number does matter. That number matters because if that number moves a percentage point, then schools might be closed and businesses might be closed tomorrow. Does it mean that there's a difference on the ground, the way the city sees it versus the way the state sees it? No, not really. It's just that sometimes data are messy and complicated.
Right. I mean, there can be a political element too. Like I often wonder, and I don't know the answer, but I often wonder if the state picks their algorithm, right, for percent positivity, for example, because of the way they want the numbers to look. I doubt that that's a health analyst that is making that decision, but it's quite possible that at some point in this chain of decision making, there are political things that come in to play. So definitely can't discount that, and that has been something that happens when mayors change. Certainly, the approach to data was different between Giuliani and Bloomberg, and then it's of course been even shifted now with more of a neighborhood focus, but which has been good now with the current mayor. So I don't know. I think there's a lot of things that make these things weird when it all comes out. So it's worth thinking about that kind of context when you're looking at the data for sure. I wanted really quickly though to go to answer sort of your larger question, because there's something that I always get asked about, and there are two related things actually. One is, why don't you have the data at a smaller aggregation? Okay, so people are always asking, like, if we give that to them, it doesn't matter, right? If we have the data available at borough level, people want it at community district. If nobody actually wants the data at UHF level, so I won't even pretend that that's the case, but because nobody understands what a UHF is, a United Hospital Fund neighborhood. But everybody wants it more granular, right? Ideally, everybody would want to have that line level data about every individual in their neighborhood. But I think that there's a false sense of exactness around that. It's the same thing with time series data. I think a lot of our data on the tracking portal, you'll see we don't have this year's data, right? And people see that as a problem, but it takes a long time for us to process it, especially when there's other priorities. So there are lots of reasons for that. But the other thing is that a lot of the things that we're tracking, if you look at it over time, we're tracking an indicator by borough over 17 years, and it hasn't changed, right? It's always worse in the Bronx, and it has been all 17 years. And so when people are saying, well, you only have 2003 through 2016, I need 2019 data to make my decision, it's just not true. I mean, the fact is, the fundamentals haven't changed, and you need to start thinking about it from a public health perspective. Like, just because we don't have the latest information or the most granular information, that doesn't mean you can't take action to fix the problem. Right. And I think that often people look to improving the data as a way to avoid action, which is something that we've got to stop doing. So that's my soapbox.
Yeah, I was going to make that comment too about data at a finer spatial resolution, because I think what we've seen when we look at data at a variety of spatial resolutions is that the story remains the same. And often with health data in New York City, the story is that neighborhoods with lower incomes combined with neighborhoods with higher populations of people of color experience much worse health outcomes because of systemic racism and other injustices that get manifested throughout our society into our health system and into personal health. Looking at things at a finer spatial resolution doesn't change that. That story remains the same.
I think it's often a problem of funders might ask for data from a certain year or a certain area. And so it can be pretty complex to look at what we have and try to translate that into what's being requested.
Mm-hmm. That's true. And sometimes it is relevant. I mean, trends do change. If you were to look at the time series for air quality in the city, there's a big trend, and the last few years have made, there have been changes. So it's not the case that every trend is flat over time. I don't mean to suggest that either, but it's not always the most important aspect.
Right, being able to see those trends is the important part, right? Not the
I think so.
I was actually thinking about air quality when you were talking about that. I held a session earlier with a bunch of folks about community engagement and sort of do-it-yourself sensors and community projects for monitoring air quality. And it does become a challenge in a certain way for the platform that's hosting all the do-it-yourself sensor data, because they're all disparate sensors and they're all coming together in one platform. So that, is a problem. But in the sense of just knowing what your sensor is saying, if it's been good, then it's like bad, then like that's really like all you need to know,
Right.
in a certain way. It made me think of that.
Yeah, absolutely. Yeah, that you got to, as long as you can compare, that's the important thing. And if measurement is consistent across the instrument, but but I think the problem is that, before you understand that, you do the thing where you say, you look at the state's data one day and you look at the city data the other day and you're like, oh my God, it got worse. But it's a different measurement. So that's absolutely.
We have a new question in the chat. Just wondering whether there's any discussion or plan in terms of having more subgroups under ethnicity question. For example, Asian communities have so many subgroups. And I'm hoping I can give a reasonable answer to that, because a really similar question came up in previous talk that I was in. And the answer gets into how epidemiologists always prefer to communicate, not in terms of counts of things, but in terms of rates, right? So a rate being kind of like per capita, right? Instead of the number of things that happen, converting this into a certain number per 100,000 people of underlying population. So these denominators, the estimates of the number of people in these categories becomes really important. And these, by and large, come from the census, the US Census. And I believe that the health department also sort of combines some other estimates into its estimates for underlying population. But I think that there is work, but it's happening on a system-wide level in order to improve the population estimates for these denominators, so that greater specificity in these race and ethnicity categories can happen in a way that provides reliable data. A poorly estimated underlying population can make something seem like much worse of a problem or much less of a problem than it actually is. But the work needed to do that is really something that needs to happen on a system-wide level in order to be reliable, and is super important because, as you point out, just Asian is a very broad category.
I would like to note we do have a report coming out on Asian and Pacific Islander health, and we have taken steps to disaggregate by heritage group. So I forget all of the groups now, but we've definitely broken it out into, I think, like Indian, Bangladeshi, Pakistani, and other South Asian, or and the same for other parts of Asia. So there may be 12 groups for each data, for each indicator that we're looking at. So that's it. It's a lot of work to, like Matthew says, like starting with what we have and then to disaggregate into these various groups. We don't always have that available, but when we do, of course, it's a much richer story. We can learn a lot more from it.
Well, it seems like the questions are slowing down a little bit, which is fine. I want to give anyone a chance if they have something else they'd like to ask, or anything that they have to say. I'd love to discuss it.
Can I ask a question?
Yes, you may.
Hi. Yeah, I teach at Bronx Academy for Software Engineering. I do computer science. I'm looking for, all of these resources so the students can make apps and digital artifacts with them. There's a lot of great links and resources in there. Is there going to be a sharing of, say, the slides, or can I get all this stuff so I can put it in a folder so I can give it to the student if they want to make an app about health, air quality, or there were so many examples in there. It was kind of overwhelming. Is there going to be a central share out spot for everything, or is it just an ad hoc thing?
Well, we don't have a central share out spot for this particular presentation, but I would say that if you go to the health department's website and you go to the data tab, all of these links are there.
Okay.
And that is really a great way to access all of this data. I think, the links that aren't there will be linked from the subpages, right? So if, for instance, once you make it, when you get to the health data tab, you'll see a variety of resources, including EpiQuery, including the COVID data page, I believe, and certainly the environmental health data portal. And when you go to our site as well, we have like branches from that tree. You'll be able to see other resources. For instance, we have links to many of the original data sources for our data sets that are available in our portal. So I think, yeah, the health data tab is sort of the core, the trunk of that tree.
Let me ask a quick follow-up.
Mm-hmm.
Do they normally have like an API associated or JSON thing where can we pull that data into an application?
We're giving you our hopeful smiles.
Yeah.
At some point, we hope to have an API.
Oh, okay.
Yeah. I've actually been involved in some of the work on developing an API for EpiQuery, but all that stuff got slowed down in the last year. It's come to a kind of a standstill development-wise, from what I understand, and I'm just on the periphery of that development work. I can say for the Environment Health Data Portal, providing the data in JSON and CSV files in a place where more folks can get access is definitely on our roadmap, probably even for this year. And I think we'd love to be able to offer an API. We have an API that actually enables some of our website functions now, but we haven't advertised it because we're actually planning to move away from that platform and get to something a little bit more stable long term. So I would say keep your eyes peeled for our, as far as our site goes. I think that you'll be seeing a lot of our data sets appearing on the website. On GitHub probably later this year.
Oh, thank you.